Good morning, doctor. Please tell, I am really afraid and I want to know everything about the gynecological cancer screening. So, let me tell you, my dear, the first test that we do for gynecological cancer is cervical cancer screening. Why, doctor? Because it is one of the most important cause for the death in women. Just think of it. So, what do we do for the cervical cancer screening? So, before going for that cervical pap smear, let me tell you what is cervix. Cervix is the small organ of approx 3 cm in lower part of the uterus, and there can be chances of cancer there. So, how do you see it? We see it by putting speculum in the vagina. So, do you think I am having cervical cancer? No, dear. First, we go for the cervical cancer screening method. So, what is cervical cancer screening? Dear, it is cervical pap smear and HPV testing. Why do we do it? To detect cervical cancer in premalignant state. And how do we do it? We do it by putting a speculum in vagina and then by using cytobrush, the discharge cell from the cervix is taken. A slide is made and it is seen by experts in the lab through microscope. So if any cancer cell is there, we can find through it. So whom do we do it? After the age of 30 years, every year for 3 negative results. Then every 3 years up to the age of 65. Doctor, is it painful? No, not at all. Is it very expensive? No, not at all. It will take some money but not very high. Is it 100% diagnostic that suppose we get cancer cells, I am having cancer? No, dear. We go for the confirmation by another method. What is that, doctor? That is cervical biopsy. So how do we do the cervical biopsy? We take a small punch biopsy from the cervix in operation theatre under anesthesia. So doctor, tell me why it is so important that we should go for cervical pap smear? Good question. Dear, cancer is a deadly disease. It takes life. But suppose we diagnose in early stage or pre-malignant stage, survival is very good. So every woman should go for the cervical cancer screening test from the age of 30. Thank you so much.